In their Williston home, Melissa and Randy Mack have pictures everywhere. Thousands of photographs are stored on computers, placed on the walls, or are in frames anywhere they can find a place. The pictures of friends and family bring them joy.
And so then our second night was bringing her home from the hospital, and with her little on-cue bag and nursing her, and so we took some photos and you know.
We're unique. Yes, we know.
Yeah, we're not like everybody else. We're definitely not.
But there is one photo they don't have yet, a photo of the child they hope to have together. Melissa has children from her previous marriage, then had her tubes tied. Randy has never had children. They both want a baby together.
She is one of the rare women that actually said, like, I want to have kids. I'd like to have another one with you. And you give up hope on that after a certain age. You just think that, it's a less popular thought.
Yeah.
And
definitely less popular in your 40s.
Yeah, so
we've heard all the old jokes, and you're going to be the oldest one in the waiting room, and all this.
Their search for the least invasive procedure to reverse Melissa's tubal brought them here, to the Robotic Center at North Florida Regional, and to Dr. Jean Cook, who is among a small number of surgeons who perform a tubal reversal robotically. Before this surgery could happen, Dr. Cook had to review Melissa's records and make sure she's a good candidate.
When a patient comes to me and wants to consider tubal reversal, there are a few things that I ask them to provide me before I even ask them to come in for a consultation. So I look at the operative report. How is the tubal done? There are certain tubals in which the entire tube is destroyed or removed. And in that case, I don't want to hold a woman's hope up to believing that we can reverse this when we absolutely can't. But there's a more typical type of tubal that's usually done right after a baby's born, in which just about a 2-centimeter segment of the tube is removed. And if that's all that we think happened at the time of surgery, and there wasn't a lot of burn artifact, that's a very good candidate for a tubal reversal.
Melissa Mack was a good candidate for this surgery, and Dr. Cook says the procedure went well. For Melissa and other women like her, recovery from robotic surgery is fast and complications are less likely.
Absolutely ideal for this sort of delicate surgery, because not only are the incisions delicate, but it inherently lets us manipulate the tissue that we want to be very careful that we don't injure during the course of the surgery. So we're able to very easily identify the what we call the proximal and distal ends of the fallopian tube. We're able to use little tiny miniature scissors to reopen the tube, and we are able to use suture that is finer than human hair to put the tube back together. And we're able to do this as an outpatient procedure. Melissa was home with her family within about 2.5 hours of the surgery.
Not long after her robotic procedure, Melissa is fully recovered.
No complications, really very little pain, considering.
That device they have, the pharmaceutical delivery system, was a miracle.
Yeah,
it really
the on-cue is fantastic. But it was pretty simple. I don't recall any, definitely no complications, and went back for a 2-week checkup and everything was great.
And she and Randy are trying to become pregnant. Everybody's excited, including would-be big sister Tracy.
I think I want a boy. I don't really get along with my sister. I get along with my brother more.
For Melissa and Randy, the gender doesn't matter. They just want a baby and know their chances are 50-50. They remain hopeful that soon they will have pictures of their child to add here in their home. And they promise to share that birth story because it might help other couples like them try and not give up hope.
Okay.
Let's see here. Here, one more try. I know. All right, I'll get underneath it.
There.
Put your hand under my hand. There you go. I want your wedding ring there. There you go.